Hello everyone and welcome to the course of general surgery. Today we're going to talk about surgery as a science, antisepsis and asepsis. Surgery is a branch of medicine that is concerned with the treatment of injuries, disease and other disorders by manual and instrumental means. Surgery divided by itself into many branches such as purulent surgery, dental surgery, abdominal surgery, thoracic surgery, neurosurgery, surgical oncology, general surgery, and many others. What is general surgery by itself? General surgery encompasses a broad range of surgeries which includes surgical conditions of the gastrointestinal tract, breast conditions, kidney, pancreas, and liver transplantations, traumas to the abdomen and thorax, certain skin conditions, initial assessment of patients with peripheral vascular disease. Elective surgery is also an important part of the work. In this course, we'll be talking about the basis of surgery, aseptic and antiseptic, surgical infections and its prevention, wounds, bleeding, dysmorphia, anesthesia and pain control, and much other basic stuff that you would need to know before you start learning other branches of surgery. General surgery is the first step into the specialty of surgery. General principles of asepsis are laid down by Hungarian. These principles were accepted after Joseph Lister, a father of antiseptic surgery. He studied the prevention of wound infection. The main definitions on this lecture will be: cleaning is a process that removes visible contamination but doesn't necessarily destroy microorganisms. It's a necessary prerequisite for effective disinfection or sterilization. Asepsis, term used to describe methods which prevent contamination of wound and other sites by ensuring that only sterile objects and fluids come into contact with them. Antisepsis is the procedure of or application of an antiseptic solution or an agent that inhibits the growth of microorganisms while remaining in the contact with them. Disinfection is a process that reduces the number of viable microorganisms to an acceptable level but may not inactive some viruses and bacterial spores. Sterilization is the process of destruction or removal of all microorganisms from an article, surface, or medium, including spores. Sanitizing it's a process that reduces microbial population on the object to a safe level. Decontamination, a process that removes pathogenic microorganisms from an object to make it safe to handle. Disinfection, the process that eliminates defined pathogens, not all microbial forms. Main difference with sterilization is lack of sporicidal activity, categorized into 3 levels: high, intermediate, and low. So if you look on this graph, you can see different levels of resistance of microorganisms. And you definitely can differentiate the different levels of disinfection and its effect on the microorganisms. And you can see also that any disinfection haven't sporicidal effect such as sterilization have. All instruments are classified into 3 categories depending on the risk of transmitting infection and the need of sterilize them between uses. They are critical, semi-critical, and not critical. Spalding classification system used to determine this kind of instruments. For example, critical, we can say about implants, scalpels, needles, and semi-critical is a flexible endoscope, for example. Non-critical is thermometers, for example. To achieve sterilization of any instruments, three definite stages are to be completed. They are pre-sterilization cleaning, sterilization process, and aseptic storage. Pre-sterilization cleaning objective is to remove all of the organic matter, blood, and saliva. There are three methods for cleaning: is manual, ultrasonic, mechanical washing. Manual cleaning is the simplest and the cheapest method, but time-consuming and difficult to achieve. And the staff what provides actually the manual cleaning must be aware of some traumas what they can achieve working with contaminated needles, for example. The material used for manual cleaning is soap and detergents. Ultrasonic cleaning, the principles is the conversion of electrical energy into vibratory sound waves that pass through a soap solution containing the instrument, used mainly for boss, bone files, bone cutter, artery forceps, saw, and many others. On this slide, you can see the general appearance of ultrasonic cleaning device. Mechanical washing it's when the high pressure jets of water with or without a detergent removes some debris from the instruments. A small instruments like blades is not suitable for this method. But from the right side of the slide you can see the sample of mechanical washing device. On this slide you can see classification of different methods of sterilization and disinfection, such as physical methods, chemical and mixed methods. About each of these methods we'll be talking later on. Heat is the most common and one of the most effective methods of sterilization. Factors influencing on sterilization by heat are nature of heat, dry or moist, for example, temperature and time, number of organisms what present, whether organisms has sporing capacity, type of material from which organism is to be eradicated. For example, for the sterilization with this method, we're using hot air oven. It's used for the materials and items which do not get damaged by high temperature, such as laboratory glass, instruments with sharp cutting edges, powders, mouse mirrors, and on this image you can see the general appearance of the hot air oven. So the time and temperature. This sterilization is complete if these two factors are achieved through the load. So you can see that if you have a higher temperature, you need a lesser time to sterilize things. The sterilization control of hot air oven can be divided actually for two types. It's a microbiological test of a dry heat, it looks like that, and a Brown's test strips contain a chemical indicator. Moist heat causes denaturation and coagulation of proteins. It can be divided for pasteurization, tyndallization, and for example autoclave. It's the methods of sterilization when used the pressure and temperature. So it has a high penetrating capacity. It gives a large amount of heat to the surface with which it comes in contact. And on these pictures you can see the main and general appearance of the autoclaves. On this slide you can see what autoclave consists of. And you also may know that to achieve sterility, a holding time of at least 15 minutes 15 minutes at 121 Celsius or 3 minutes at 134 Celsius at 15 psi above atmospheric pressure is required. To avoid corrosions, you may add ammonia to the autoclave. Irradiation methods. It's usage of radiation for sterilization. It can be divided for ionizing radiation and non-ionizing radiation. Ionizing radiation, it's usage of X-rays, gamma rays, and cosmic rays. They have a high penetration power. Non-ionizing radiation divided for ultraviolet and infrared. Both of them used mostly to purify the air. Ethylene oxide sterilization. It's used mostly and exclusively to sterilize medical products that cannot be steam sterilized or sensitive to radiation. Mechanism of action. It destroys microorganisms by alkylation and it causes denaturation of nucleic acids of microorganisms. It's used for plastic, rubber, photographic equipment, and sterilization for disposable items, plastic syringe, needles, catheters, bladder, blades, and things like that. And disadvantages of this method, it's a length of cycle of sterilization and cost and potential hazards of this method. Next step of sterilization is aseptic storage, the maintenance of sterility during transportation and storage. It's very important. Instruments are kept wrapped until ready for use to reduce the risk of contamination. The chemical disinfectants works through the following mechanisms. It's the cell membrane injury, coagulation and denaturation, interaction with functional groups of proteins of bacteria. Antiseptic environment need to be protected by zones. For example, outer and general access zone, where is the patient reception area and general office, clean or limited access zone, the area between reception, general office and corridors and staff room, restricted access zone for the properly closed personnel engaged in operation, aseptic or operating zone, the operation theatre, or operation table, for example. The hand washing can be divided for social hand washing, clinical hand washing, and surgical hand washing. On this video, the professionals will demonstrate how to proper hand wash for the surgery and how to actually close this for the surgery.
Surgical scrub-up and gowning, a step-by-step guide. The purpose of the surgical hand antisepsis is to remove or destroy transient microorganisms and inhibit the growth of resident microorganisms.
Hi, I'm Jonathan. I'm the new junior doctor. I've been asked to scrub up, but I've never done it before. Could you show me how?
Certainly can. Come this way.
Thank you.
Preparation. When preparing to scrub up, ensure that you wear appropriate attire and make sure this is as comfortable as possible. This includes clothes, hat, masks and eye protection. Jewellery such as bracelets, watches and rings are to be removed, other than plain band wedding rings, which can remain in place. Nail varnish and false nails are also to be removed beforehand, and nails should be kept short. Any skin abrasions to hands and arms must be covered with a waterproof dressing. Select an appropriate gown pack, checking integrity of the package and expiry date. Peel open outer wrap of gown pack, leaving green layer untouched. Select appropriate gloves and place nearby, ready to be opened by the circulator. Surgical scrub. Set the water to a suitable temperature and flow and open a nail brush packet.
Okay, so we'll start washing our hands now.
Throughout this process, the hands must be kept upright and bent at the elbows, allowing water to drain away, clean to dirty. Wet hands and arms thoroughly. Apply approximately 5 mils of aqueous scrub, for example Hibi scrub or Viodine, to the hands, using your elbow to release it from the dispenser. A hypoallergenic alternative is also available. The first wash should take about 2 minutes and includes washing the fingers, hands and elbows, arms up to the elbow. To be effective, the aqueous scrub needs a minimum of 2 minutes contact time with the skin. With fingers interlaced, work palm to palm. Place right palm on the back of left hand with fingers interlaced. Repeat on the other side. Rotational rubbing backwards and forwards with clasped fingers of right hand into left palm and vice versa. Rotational rubbing of right thumb clasped in left hand and vice versa. Rubbing fingertips on the palms of both hands. Continue with rotating action down opposing arms, working to just below the elbows. Rinse thoroughly, keeping hands above the elbows so the water always drains from hands to elbow. Take hold of the nail brush and apply surgical solution, approximately 5 mils again. Brush both right and left nails, but only the nails, not the fingers, palms or hands, as this can cause skin damage. This must last about 1 minute. The nails only need to be scrubbed on the first surgical scrub of the session. Any more often can lead to skin damage and colonisation. Again, rinse thoroughly, leaving hands higher than elbows. The last wash repeats the first, but this time only goes as far as the wrists to avoid compromising the cleanliness of the hands, and should last approximately 1 minute. Again, thoroughly rinse hands and arms and turn the taps off with your elbows. Let excess water drip away. Do not shake. Keep hands higher than elbows. The whole process should take about 4 minutes. Gowning up. Moving over to the gowning trolley, open the green inner pack, ensuring you open away from your body first. Carefully, fully open a hand towel. Dry your hands by placing the towel in one hand and blotting the skin, drying on the opposite hand. Always start at the fingertips and work down towards the elbows using a corkscrew movement, and then discard the towel. Never go back up the arm towards the hand with the towel. Repeat on the other side, ensuring hands are completely dry. Gowning is achieved by using the closed gloving technique. Pick up the gown and identify the neck area, then step away from the trolley. Using your thumbs and first fingers, pinch the top of the gown and let it fall. Do not shake. Ensure it doesn't touch anything. Unfold the gown and identify where the arms are to be placed and do so. Keep hands inside the gown. A circulator will now tie the gown at the back. Keep arms above waist level. With hands inside the gown cuffs, pick up the gloves in its inner sterile wrapper and then turn them upside down so the right is on the left side and the left is on the right side. With your right hand, place your thumb under the fold of the right glove, then flip the glove over onto the palm of your covered hand. With your left hand, grab the fold on top and pull up and over your hand. Next, pull gown and glove up your arm so that the fingers are in the correct position. Repeat this process with the other hand. The gloves must cover the cuff of the gown as this is not waterproof. Ensure gloves feel comfortable and fit snugly. Take hold of the gown pass card and pull the left hand tie out of the card, keeping hold of it. Pass the card to the circulator, being careful not to pull the remaining tie out of the card. Next, rotate 360 degrees anti-clockwise and pull the tie out of the card held by the circulator. Now secure both ties in a bow at the side. You are now sterile around your front and back. Keep your hands away from your face and above waist level. You are now ready to enter the sterile field. Once in the sterile field, hands should be kept at chest level at the front. Do not cross hands or put them under the axilla. When you pass another person who is scrubbed, try always to pass back to back.
Thank you for watching and see you very soon on our following lectures.